everyone. Thank you for joining us today at our virtual reality Naloxone training webinar. We are thrilled to partner with Walmart to present this unique experience. I would also like to thank the many community stakeholders and leaders that unite to support this event and all of the work of Jackson County Prevention Coalition. Your commitment to change is the greatest testament to the impact of our work. CADCA and Walmart launched the Naloxone training we'll see today in February of 2020 at CADCA's National Leadership Forum. Since then, CADCA has held more than 25 virtual screening events and engaged thousands of participants. We look forward to continuing this initiative and training countless more communities. Today, we'll hear from a wonderful group of speakers here in Iowa who are working every day to save lives. Then we will view a virtual reality simulation developed by Walmart that demonstrates a few different scenarios on how to recognize when an overdose is happening and how to administer naloxone. Our goal is to learn how to use this technology to help community leaders like you save lives and create a norm that every life is worth saving. Now I am pleased to introduce our first speaker, CADCA's Chief of Staff, Valentino Murphy. Valentino joined CADCA in 2021 and has been working ever since to help further their mission of building and maintaining safe and healthy drug-free communities. We appreciate him being here today to speak with us. Valentino?
Thanks so much, everyone. I am thrilled to be here. First, I want to extend my gratitude to Walmart for their commitment to saving lives through this innovative training. I'd also like to thank our friends and supporters at Jackson County Prevention Coalition. It's an honor to be here alongside such remarkable leaders from the great state of Iowa. CACA has a footprint in over 30 countries and more than 5,000 coalitions across the United States. We seek to train community residents and leaders to develop our coalitions and reduce substance misuse by adapting CACA's model for community change. CACA knows that prevention is the most cost-effective way to reduce substance use and misuse. It's important to emphasize that prevention is more crucial than ever before. Recently, the CDC reported that there were over 109,000 fatal drug doses in the United States in 2022. To put that number in perspective, it is greater than the entire population of Davenport. For the past 4 years, one American has died every 5 minutes due to preventable drug-related causes. It's a tragic reality, and we must do everything in our power to address it. As we train coalitions in substance use and misuse prevention, it's crucial that we have leaders and community stakeholders like yourselves engaged and committed. You are true heroes driving positive change. Our partners at the Drug Enforcement Administration continue their One Pill Can Kill campaign, which has raised awareness about fentanyl-laced pills that are killing so many Americans. Their message could not be clearer. If you did not receive your medication from your licensed pharmacist, do not take it. We have seen what one pill laced with fentanyl can do, and we do not need to see any more lives lost. As DEA Administrator Ann Milgram shared at CACA's 2023 National Leadership Forum, this is not a war on drugs, but a fight to save lives. We also need to be vigilant of trends popping up in our communities. Our partners at the Office of National Drug Control Policy have identified xylazine as a key emerging threat. It interacts with opioids in a devastating way that leads to overdoses. An example of the spread of this dangerous trend, some programs are reporting that drug samples they are receiving rarely contain heroin, while 99% of them contain fentanyl, and 4 out of 5 samples contain xylazine. In this current landscape, we need every available tool to save lives and help our communities recover from this drug crisis. Keep up with good work. I look forward to seeing you in person soon. Thank you for having me on today, and back to you, Julie.
Thank you for those remarks, Valentino. We appreciate you joining us. And now we're excited to share with you a special remarks from Senator Chuck Grassley. Penny Vasek, Senator Grassley's representative here in Eastern Iowa, will be reading Senator Grassley's remarks. Senator Chuck Grassley hails from the great state of Iowa, where he learned to grow soybeans and corn from an early age and worked in several factory floors as a member of the International Association of Machinists. Grassley has served the people of Iowa since 1958 in the state legislature and the U.S. House of Representatives. and in 1980, Grassley was elected to the U.S. Senate. On the national stage, he's developed a reputation for bipartisanship and pragmatism. Senator Grassley was the original architect of the Drug-Free Communities program in 1997, and in 2006 received KADCA's highest honor when he won the Lifetime Achievement Award. He is a member of the Senate Budget Committee, Senate Judiciary Committee, Senate Finance Committee, Senate Agriculture Committee, and Joint Committee on Taxation. He also is the co-chairman of the Caucus on International Narcotics Control and the longest-serving Republican senator in Congress. We're so excited to share his message with you. Thank you, Penny.
I appreciate the opportunity to discuss the opioid crisis with all of you. The Center for Disease Control and Prevention reported opioids were involved in 80,411 overdose deaths, over 75% of the nearly 107,000 drug overdose deaths in 2021. Sadly, the number of overdose deaths in the United States recently has climbed to over 112,000 a year. The opioid epidemic has devastated our Iowa communities, and the number of overdose deaths in opioids will continue to rise in Iowa and in other communities across our country. As we continue to seek solutions to the opioid epidemic on Capitol Hill, we need to ensure that the federal government continues to take action at the border and within our communities. We need to give our communities access to all of the education, tools, and support they need to fight this epidemic together. For starters, President and federal government need to secure the border. I continue to call on President Biden to uphold his oath of office and protect our national security by enforcing the immigration laws that are on the books. Securing the border will help federal agencies stop the flow of fentanyl and other harmful opioids into our communities. The federal government needs to do more to crack down on precursor chemicals originating from foreign supply chains such as China. These precursor chemicals are what's used to make the drugs that are devastating our communities. If you take the precursor chemicals out of the hands of drug traffickers, then drug traffickers won't be able to make fentanyl. In July 2023, I co-led legislation with the late Dianne Feinstein, which the Senate unanimously passed, designating August 21st, 2023 as Fentanyl Prevention and Awareness Day. Additionally, in May 2023, I reintroduced the bipartisan Stop Pills That Kill Act. This bill would apply the increased criminal penalties for possessing, manufacturing, or distributing certain equipment or materials that are used to illegally manufacture fentanyl, an analog of fentanyl, or a counterfeit substance. In April 2023, I hosted a roundtable in Cedar Rapids to discuss the ties between organized retail crime and the illicit drug trade. In October 2022, I convened a hearing of the U.S. Senate Caucus on International Narcotics Control and heard courageous testimony from Iowa families who lost loved ones to fentanyl poisonings. Within our communities, the federal government needs to do more to prevent both the sale and consumption of dangerous opioids like fentanyl. That includes permanent scheduling of fentanyl-related substances. But the problem is already here, and stopping the future flow of fentanyl won't do much to help those afflicted by the fentanyl already within our borders. We all need to be vigilant about the dangers drugs pose to our communities. I'm glad to hear that today you'll be learning about one of the tools that can help our communities address this problem. Thank you for taking this important step to protect others. Naloxone is a key treatment tool used to interrupt overdoses and temporarily block the effects of opioids. When used effectively, naloxone can restore normal breathing within just a few minutes. In areas where emergency health care is limited, resources like these are critical to addressing overdoses. By participating in today's program, you are equipping yourself with an important tool to help protect those around you. Know at the federal level, I will continue to advocate for the ability of naloxone to treat drug overdoses for our first responders, especially those in rural areas. Thank you again for inviting me to discuss this important issue with you. Thank you.
Thank you, Senator Grassley, for your leadership and impact. We're so fortunate to have your voice promoting prevention on Capitol Hill. And now we'll be turning to our partners here in Jackson County. Our next speaker today is Marilyn Osterhaus. Marilyn Osterhaus is a community pharmacist who formerly co-owned Osterhaus Pharmacy in Maquoketa, Iowa. She is a graduate of the University of Iowa College of Pharmacy and an adjunct faculty member of the University of Iowa College of Pharmacy and Drake University College of Pharmacy, serving as a preceptor for community care pharmacy practice residents and doctor of pharmacy students. Marilyn is an active member of her local, state, and national pharmacy associations. She has served in a variety of leadership positions, including president of the Dubuque Area Pharmacists Association and a board member of the Iowa Pharmacy Association, and is an emeritus member of the University of Iowa College of Pharmacy Alumni Board. Marilyn is actively involved in her community and currently serves on the board of the Jackson County Substance Abuse Prevention Coalition, the Jackson County Historical Society, and the local chapter of POE. Marilyn, we look forward to hearing from you.
Hello, I'm Marilyn Osterhaus, a community pharmacist in Maquoketa, Iowa. I'm a member of the Jackson County Prevention Coalition. Across the state and nation, we are sadly seeing alarming increases in opioid overdose deaths. Many of these are from the drug fentanyl, which is being illicitly manufactured. Morphine, also an opioid, is used as the standard to measure the strength of different opioids. Fentanyl is 50 to 100 times more potent than morphine. A fentanyl overdose alone is dangerous. Today, it is frequently being used in combination with other opioids and/or stimulants. These combinations are even more life-threatening. Research of drug overdose deaths in 2019 in 24 states over a 6-month period concluded approximately 80% were due to an opioid or a mix of illicit opioid drugs. The total deaths were 16,236. Of these deaths, 10,203 contained illicitly manufactured fentanyl. In these cases, when someone died, another individual was reported to be present 6 out of 10 times. This would have been a time for an intervention with naloxone nasal spray. Naloxone was developed in 1961 in an injectable form. It was originally used in hospitals and emergency room settings to reverse and block overdoses of opioids. As of 2015, naloxone, now in a nasal spray, was approved for emergency treatment of opioid overdoses. It is now available without a prescription as an over-the-counter medication. There is strong evidence overdose education and naloxone training promotes understanding in caregivers, friends, and family of naloxone's role in preventing tragedy in those with opioid use disorder. Studies have shown 2/3 of those educated will administer the nasal treatment to someone showing the signs of an overdose. A 2015 study in Massachusetts showed overdose death rates were reduced in communities where opioid education and naloxone distribution and training was implemented. There's no evidence the availability of this rescue medication causes persons with opioid use disorder to increase their overuse of opioids, but it can provide the opportunity for a person with opioid use disorder a chance to survive and receive treatment for his or her illness. There are multiple ways to access naloxone as a caregiver, family member, or a person with opioid use disorder through your local pharmacy, your primary care physician, or local state agency. The potential to save lives increases as we put this medication in the hands of more people. I urge you to explore the resources in your area and be prepared to save a life. Thank you. Have a good day.
Thank you, Marilyn, for everything you do for the coalition and for sharing your insights with us today. Our first speaker here is Mike Sturm. Mike is the Jackson County Emergency Medical Services Coordinator, representing the Jackson County EMS Association, which is comprised of transport and non-transport EMS agencies operating within Jackson County. Mike is a nationally registered paramedic, state of Iowa critical care paramedic, and an EMS instructor. Mike has 16 years of EMS experience in 911 response. interfacility transport, and hospital-based EMS. As an instructor, Mike has taught public CPR classes, stop the bleed courses, and basic first aid, along with initial and continuing education EMS courses. Mike, thank you for joining us today.
So my name is Mike Sturm. I am the EMS coordinator for Jackson County, Iowa. I represent the Jackson County EMS Association. And I'd like to talk to you a little bit about what our EMS agencies are doing in response to overdoses and opioid overdoses in general. As public education wise, we are very active in the community regarding the dangers of opioid overdoses and what our general public can do to assist those having an opioid emergency. We utilize the American Heart Association's CPR and first aid courses that cover the use of Narcan by the general public and what they can do to respond to opioid overdoses and when to utilize Narcan in those situations. So Narcan is becoming more and more prevalent out in the community for our lay citizens to be utilized when a family member or a close friend of theirs has a opioid overdose. So we can reverse the effects of that opioid overdose and have a great outcome for that patient. The state of Iowa is a very rural area, and it's largely made up of volunteer EMS services. So the rural nature of our state leads to longer response times for our ambulance services when we are responding to emergencies, specifically opioid emergencies. This longer response time has a negative effect on our patient. Narcan needs to be given to our patients as soon as possible after overdose is discovered. Otherwise, the outcomes for our patient are not good. Additionally, staffing is an issue in EMS in general, not just in the volunteer sector, but even with our career sector. So with our services having staffing issues, that may require an ambulance to come from even further away if we are not able to staff the local ambulance. In the state of Iowa, EMS is not an essential service. The state law requires that cities and counties have to provide police and fire protection, but it does not state they have to provide EMS services. So response times for EMS services to emergencies can be delayed and maybe not even available in some areas. In order to help EMS respond to emergencies, specifically in opioid overdoses, we partner with the local police departments and sheriffs. Law enforcement has been trained and they have access to carry Narcan or Naloxone in their squad cars. Typically, in an emergency, law enforcement is there prior to the arrival of EMS, and that can even be by several minutes. So we have our police officers, our sheriff's deputies trained in the use of Narcan, the recognition of possible opioid overdoses. And we have had instances where police officers have given multiple doses of Narcan and had a great outcome for our patients that were having an opioid overdose. So that partnership between EMS and police has been very beneficial for our county, and I know across the state of Iowa have similar partnerships. The police department also has Narcan available for their self-use. If they have an incidental or accidental exposure to an opioid, they can utilize Narcan on themselves or on their partners to help combat the effects of that opioid, especially with our police officers who do not take opioids on a regular basis, like someone that may have an overdose. The effects can have a massive impact on their health, and it can affect their health rapidly versus someone who has built up a tolerance to opioid overdoses. Another partnership that we have kind of started with our law enforcement, and EMS has started this in the past few months, is utilizing OD mapping. the national database that tracks, maps, and finds trends in overdoses so EMS and police departments can concentrate their prevention efforts and response efforts on particular areas that have an increase in overdose cases. This is not to get someone in trouble. This is not to track them and have a punishment. This is law enforcement and EMS working together to help these individuals survive opioid overdoses, give them prevention materials that they need so that they can get the treatment they require to hopefully combat their addiction and get past their dependency on the opioids. And we can limit those opioid overdoses, especially opioid overdose deaths in our county and in our state. Thank you for listening to what law enforcement and EMS is doing in Jackson County, Iowa. Our goal is to help our patients the best way possible, whether that is through prevention efforts, increasing our EMS response efforts, partnerships with law enforcement, or getting Narcan and Naloxone available to the general public so it can be administered as soon as possible in an opioid emergency.
Thank you, Mike, for sharing more about your work. You play such a vital role in spreading understanding and giving so many of our first responders the tools they need to serve our neighbors. Next, we'll be hearing from another of our local heroes, Christina Skiles. Christina received her bachelor's in early education and worked in the public school district before transitioning into substance use prevention with the Area Substance Abuse Council, where she now works under Iowa's State Opioid Response Grant and the Integrated Provider Network. Over the last 3 years, Christina's work in prevention has included educating first responders, healthcare providers, and caregivers on prevention strategies. Christina has built relationships with stakeholders across the community to foster collaborative efforts for prevention. Christina has worked closely with local law enforcement agencies, leading community outreach activities, connecting our neighbors with resources, and training local groups on how to administer naloxone. Christina, thank you for sharing your time with us.
Hi, thank you for joining us. My name is Christina Skiles. I work for Area Substance Abuse Council over on the eastern side of Iowa. ASAC has 7 different counties that we work in. We work in Benton, Clinton, Delaware, Dubuque, Jones, Jackson, and Lynn counties. I myself am a prevention specialist. I have been with ASAC for about 3 years working in the prevention department. I am a certified prevention specialist. My main job with ASAC and the grants I cover is to educate, and I enjoy educating. So I get to educate our first responders, healthcare, and anybody who is in that position to assist and be a caretaker. So when we talk today, we're talking about Narcan, and Narcan is very important, and I'm very passionate about it now. When I first started in prevention, I really didn't understand why I'm going out and educating our first responders and healthcare on primary prevention strategies to address opioid use or general overdose education or psychostimulants or stigma associated with a substance use disorder, which we know is a major barrier there for a person to go into treatment. However, when I sat down with my director and started talking to her about why I was the chosen one to be the Narcan trainer for a couple different counties, when I thought I was in primary prevention, and I say I do this because it's a scale with the continuum of care, but I'm in primary prevention. I'm trying to go upstream and stop something from happening before it actually does. And with Narcan, we know that that has already happened. The overdose has already happened. The use has already happened. However, the use is not always because somebody is a substance use or has a substance use disorder. It could be somebody who was poisoned by fentanyl. It could be grandma or my mom who loved her pain medication, who would she would sneak it, or they forgot when they took it. And then they have an overdose. I carried on my own person, my kids, my adult children, they carried on them too. You could always be in the position to assist, and we have to be those better people and drop that stigma and be there readily available to save a life. So as I was talking to my director about why I get to train on Narcan after, the primary prevention part, and then you go into secondary and third or tertiary, and it's in the harm reduction category. And a lot of people don't understand with harm reduction. And she said to me, she's like, she didn't understand it either at first. But then, just to break it down and simplify it, we're trying to prevent a death. So that is prevention. Maybe it's not in this first slot or second slot or whatever, but it's preventing someone from dying. And who are we to say, well, enough's enough and I'm done? No, we can save a life. So we have to do our part to be better humans and save lives. So with that, we talk about Narcan, and I go out and I educate on Narcan, and we have to know the signs. It is ultimately a respiratory crisis. The signs of an opioid overdose are exactly what you would expect from a person who is not getting enough oxygen. What it does is that opioid covers that receptor. What Narcan does is it comes in and pops that off there. However, it is super important to remember that when you administer Narcan, 911 needs to be on the phone, and they need to go get medical help, because Narcan only lasts for so long. That opioid's still in there and it lasts longer. And the likelihood of them overdosing again is very high. So they need that medical support. It's super important. So keep that in your mind. Education on how to administer Narcan, super important. It's super important to remember those steps and know that you're safe and that person is safe, and to administer that to save their life. There's going to be a lack of response with this individual. If you're shaking them and doing a sternal rub and they're not responding, most likely an overdose. Now, if you don't know what kind of drug they ingested, it's okay. Do it anyway. It's not going to help you if it's methamphetamines or psychostimulant or alcohol. It's not going to do anything. However, for an opioid overdose, it will reverse those effects. So Narcan comes in a box like this, but there's 2 in there. Now, each nasal device on here, it's one and done. Don't prime it. You use one, you wait a few minutes. If there's no response, use the other one in the other nostril. Super important to have that education and know the signs, know how to administer, get 911 on the phone. You can get Narcan in many different places, especially in Iowa now. It's available at your local pharmacies. You can either get it from the pharmacist or OTC. The pharmacist, they're going to talk to you. They're going to give you that education too. You can either do the virtual reality education. You can call me at ASAC. I'll give you the education. You can go online. You can go to any of your behavioral health, substance use disorder facilities, and they can give you that education too, to be able to save those lives. You can go on naloxoneiowa.org and you can have a meeting, telehealth meeting with a pharmacist, and they can instruct you on how to use naloxone, and then they send it to your house. So there are a lot of different ways that you can access Narcan. ASAC itself is a secondary distributor now, so I can have a patient who needs Narcan and could be in the position to assist. I go talk with them. I give them the rundown of how to administer and how to identify an overdose, and they take it with them. It's in their hands, and they're in a position to save the life. I will tell you what, one of the first ones that we ever gave out to a person who was in a position to assist actually saved a life. That, yes, we still have so much more to combat and so much more to fight in this opioid crisis. However, one at a time. We have to save lives. We have to change our minds, our hearts, so we can change lives. And that means we need to end the stigma. We need to carry the Narcan. We need to know how to administer it. So it's super important. I do appreciate you taking the time out to listen to me today. If you ever want a training, we have those training opportunities here at ASAC. We also offer not only prevention, but treatment and recovery services. So we have the continuum of care here. We have outpatient, inpatient, and all around support groups. Please let us know if you ever need anything. And if you have a loved one or yourself, contact ASAC, please. And if you need training, contact us. Thank you so much.
Thank you, Christina. We're so lucky to have you making such a direct impact on people's lives. Our final guest speaker today is Rod Courtney, the Executive Director of Crush of Iowa. Rod has his associate's degree in human services from Kirkwood Community College and his bachelor's degree in social work from the University of Iowa. Rod was a sergeant in the United States Marine Corps until 1976 and retired from a 20-year career as a probation and parole officer for the 6th Judicial District in 2018. Rod dedicated his career to engaging families and the community in his work. After losing his 38-year-old son to a fentanyl overdose in November of 2016, Rod quickly connected to Community Resources United to Spread Hope, or Crush of Iowa, where he now serves as executive director and has helped to develop and coordinate Crush Family and Friends Support Group. Rod currently works along with his wife, Debbie, volunteers from the recovery community and local agencies, and has established a peer-based recovery community center in Cedar Rapids, Iowa. He continues to advocate for improved recovery resources for those still suffering with substance use disorders. Rod, we're happy to have you join us today.
Well, hello, everybody. It's Rod Courtney, and I am the executive director of an organization in Cedar Rapids County, Iowa, called the Crush Recovery Community Center. And I would like to thank everyone for letting me be part of this very, very important topic, something that is absolutely near and dear to my heart, and the work we do here at Crush. You know, I want to start off with local data just to lay a little bit of a foundation. But here locally in Iowa, we had 384 overdose deaths last year, which is significant. When I think about those deaths, I go on and I think about the further reaching impact of overdoses and how important naloxone and Narcan is in our communities right now. So we had the deaths, but the repeated doses that happen that our EMTs and our first responders respond to every day that I don't know the data on that, and I'm not sure that it's collected, but I know here locally we can have somebody that can overdose and survive an overdose 3 or 4 times in a weekend. It's the importance of that. Take it just a step out of those 384 deaths that we had, there was an opportunity for some type of intervention in 84.9% of those cases. That's the significant number. And again, that's just the numbers that we know. So we have a 104% increase. That's 141,000 pills that are seized in Iowa. That's 141,000 potential doses. And that concerns me at several levels. I just want to take a kind of a quick step back and talk a little bit about how I came into this particular type of work as far as recovery communities are concerned. Back on November 1st of 2016, our old son, who had battled a substance use disorder for over 24 years of his life and 38 years old at this time, got off work from working a day job, went into a local food restaurant where somebody pulled up and gave him what he believed to be heroin. He had been injecting heroin for 2 years. He went into the restroom. He injected what we later discovered was to be fentanyl. Now, I call this fentanyl poisoning because within a week's time frame, 6 other people in Johnson County died from the same fentanyl. How long was it? I don't know. Narcan was administered by first responders. He was transported to the hospital. But here's my take on that. In that time frame that he lay waiting for first responders, how much difference would have been made if the Narcan could have been administered in that time? It's just one of hundreds of cases that I think take place, every day. That could have been a life-saving measure. So we have law enforcement. We had the ever important piece of of prevention and intervention and making people more and more aware. So that was a lot of the beginning of the work that we got into as far as having our recovery community center. We've been blessed in Lynn County with two different levels of organizations. Lynn County Public Health and Treatment Agency here in Cedar Rapids called ASAC, the Area Substance Abuse Council. And they've worked diligently at putting together vending machines. We're gonna have one right rush here in Cedar Rapids where somebody can go to the machine and get not only Narcan, but they can get other type of harm reduction and prevention type of items as far as like whether it's antibiotics, condoms, or whatever need at no charge. And so that it's just going to make accessible as far as like, it's like Narcan ought to be in businesses like a deep machine where people, if they have an overdose, they can respond. And that was going to start to help. 141,000 doses of fentanyl, 141,000 potential overdoses. And like with supply and demand, when there's too much, it's going to start going other places. It's going to start going, the stimulants in combination. The methamphetamine in particular is one where it's being used a lot. So there's a word of caution, I think, for all of us to be very, very diligent about what we're doing in this upcoming, whatever this time frame may be, certainly the shorter, the better. And to work together collaboratively and as a community to do that. So I just want to thank everybody for this opportunity just to share this much and to let you know that appreciate this work that everybody does because it's making a difference. There's lives that are being saved. That we move forward with this and continue to do this work and in the way that I see it moving forward right now. So with that, thank you for this time, and I'll let us move on to the next speaker. Thank you very much.
Rod, I'm so happy that you could share your message with our audience today. While the price your family has paid is simply unimaginable, we know the work you do with Crush truly does spread hope. And now we will view the overdose prevention simulation portion of this event. Walmart has invested in virtual reality-equipped training facilities for their associates to build skills in unique situations that are hard to replicate in a classroom setting, like front-of-the-store shopping experiences and emergency preparedness simulations. This technology led to the development of non-retail training, such as the virtual reality, which we will see next. Let's take a moment to view this training.
Dude, guess what I just swiped for my grandma?
What? Don't people get strung out on this stuff?
Yeah, that's the point.
These two industrious young gentlemen have stolen opioid medication for recreational use. Oxycodone, hydrocodone, fentanyl, and heroin are a group of chemicals referred to as opioids. The first three may be prescribed by a medical professional to treat pain, but they can be addictive and deadly, especially if not taken as directed. Heroin has no legitimate medical purpose. Opioid overdose is the current leading cause of death for people under 55. True or false? More than half of Americans have been affected by opioids. Correct. Over 70,000 people died of opioid overdose in the United States in 2017, and millions more were impacted through overdose or misuse. That means that if you have not been directly affected by opioids, someone you know likely has. But not every overdose needs to end in death. Today we're going to teach you to spot the signs of an overdose and administer naloxone, a life-saving medication.
Hey. You okay, dude? You don't look so good.
Opioid overdoses will slow or stop your breathing. This reduces the amount of oxygen in your body, resulting in pale or clammy skin. The pupils will constrict until they are the size of a pin. The lack of oxygen can cause the fingers and sometimes lips to turn blue, gray, or purple, depending on the person's skin tone.
Your breathing is weird. It's too slow.
A very serious side effect of opioids is depressed breathing. During an overdose, their breathing will become shallow, erratic, or stop entirely.
Yo, Jay. Jay. Wake up, man. Wake up or I'm calling the cops. John. Hey, I'm not playing with you. Are you breathing? Dude, you're not breathing. Jonathan.
Loss of consciousness is the final tell of an overdose. If you suspect someone is passing out because of an overdose, you should scream their name and try to wake them to see if they will respond. As with any emergency, the first thing you should do is call 911.
911, what's the emergency?
Yeah, hello? I need help.
Naloxone is a life-saving medication that can reverse opioid overdose and restore breathing. There are several types of naloxone available, and all of them provide a life-saving medication in the event of an opioid overdose. In the example today, you will see the nasal spray Narcan administered. If you happen to have the injectable form, make sure to hold the needle straight and inject it into a muscle, like the shoulder or the upper thigh. First, peel back the packaging to remove the device. The device has a plunger and a nozzle. Hold the device with your thumb on the plunger and 2 fingers on the nozzle. Be careful not to accidentally spray the naloxone before you are ready. The device only has 1 dose, so don't test it out. Put the device right up their nostril until your fingers are touching their nose. Press firmly on the plunger to release the dose of naloxone.
Come on, buddy. Wake up. Come on, man, wake up.
After you administer naloxone, place them in the recovery position and wait for help. The person who overdosed needs immediate medical care. You should stay with them until help arrives in case they lose consciousness again. Another dose may be necessary.
There you go. There you go. All right, that's it. Welcome back.
Great job. When people think of overdose, they usually think of recreational opioid use like we saw here. This is a stereotype, and unfortunately, there are many situations that lead to accidental overdose. Let's take a look at other situations that can lead to accidental overdose.
Mom? 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 Mom, wake up. Mom? Not again. My mother is blacked out. I think she's had a heart attack. Send an ambulance.
Please stay calm. I'm going to check her vitals. What's her name?
Blanche.
Blanche, I'm here to help you, okay? Is that hers? I'm going to check her for an overdose. She's got a pulse, but her breathing is slow. Let's check her pupils. All right, stay with me. Uh-oh, they're constricted. With this medication, this may be an overdose. Let's administer naloxone. All right, Blanche, stick with me, okay? 1 second. All right, I'm just gonna go right up here. The patient took too much of her prescribed medication. She forgot that she took her medication before breakfast and took another dose after breakfast. In the event that this had been a heart attack, naloxone wouldn't have been able to treat the heart attack, but it would generally be fine to administer to her without serious complications. Talk to your healthcare provider or check the package insert for possible side effects and additional information. All right, Eugene, got your stuff. Oh no. Eugene took an old opioid medication that he had previously been prescribed for pain. Usually this wouldn't cause an overdose, but he's taking a new benzodiazepine medication. When opioids and benzodiazepines mix, the results can be deadly. Always check with your doctor or pharmacist before taking any medication, just in case there will be a negative interaction with your other medications.
Sending an ambulance right away.
Opioid overdose can happen to anyone. You can overdose from opioids even when taking a prescription exactly as your doctor prescribed, which is exactly what happened to me.
All right, hotshot. I hope you're paying attention. It's your time to shine. Select the things you should look for when you suspect an opioid overdose. Now, let's review how to administer naloxone. Correct. You have to remove the device from its packaging. It will not do you a lot of good otherwise. Correct. That's how you hold the device. That's correct. You did it. You saved my life. Thank you for knowing what to do in the event of an opioid overdose. Accidental overdose can happen to anyone taking opioids, whether recreationally or even as directed by a doctor.
This information can save a life. Opioid misuse is a national epidemic, and accidental overdose can happen to anyone taking opioids. It takes an entire community to keep all our members safe from overdose. If you or someone you care about is taking opioids for any reason, consider getting Naloxone at your local pharmacy and keeping it on you at all times. No prescription is required, and it could save your life or the life of someone you care about.
Thank you to the Walmart team for developing this powerful tool. We are so excited to work with you to connect this resource with community members. We want to extend our thanks to all of our speakers and participants for attending this event. We truly appreciate your time and insight. And finally, thank you all for all the work you do for supporting Jackson County Prevention Coalition and the great Iowa coalitions local to your communities. Please visit the Alliance of Coalitions for Change to learn how to get more involved with organizations near you. We'll share that link with you in just a moment. Please reach out to our friends at CADCA, Olivia Murphy Costanzo, Business Development Associate, Sean Moore, Senior Manager, Special Projects and Initiatives, and Mia Wallace, Director of Business Development, anytime with your suggestions and questions. The CADCA team is looking forward to discussing this more and getting your tremendous feedback. This concludes our webinar, and I wish you a great rest of your week.